A new medication is out on the market for depression. Its name, and I may be butchering this, is Exxua, EXXUA, or the generic name seems to be Gepirone. I may not have pronounced those correctly, but this medication is unique because it works differently than most antidepressants out there. It is thought to agonize, or it's thought to activate the serotonin 5-HT1A receptor. And this is a unique mechanism of action. And so it's a unique antidepressant because it can help with clinical depression and not have a lot of the sexual side effects that many antidepressants commonly have. And so this is sort of similar to Buspirone or Buspar, which is used for generalized anxiety, because that also is thought to not have sexual side effects, and it works on a similar receptor system as this medication, although this one has been approved for clinical depression. Now, the dosing is pretty straightforward. It's just an extended release tablet, so it's going to be taken once a day. And the dosing starts out at 18.2 milligrams for 3 days. Then you go to 36.3 milligrams, and then you're on that for 4 days. And then you can go to 45.5 milligrams for a week, and then you could titrate up to the maximum dose of 72.6 milligrams. The most common side effects with this medication are dizziness, nausea, or insomnia. But the efficacy of this medication is a little bit debatable. It was studied back in 2001 by the Food and Drug Administration, and it was not approved then because it was shown to only be a little bit more effective than placebo when you compare it with Hamilton Depression Scale scores. For example, a Hamilton Depression Scale is basically the scale that monitors for depression, the different symptoms of depression. And people who took this medication improved only 2.5 points more than people who took a placebo medication. And so for the most part, at least at that time, they felt it was not really that beneficial. And so it was not approved by the Food and Drug Administration, but more recently it has been approved, although the data is pretty much similar to what it was back then. So this may be an option for people who are looking for an antidepressant medication that has minimal side effects. But medications are just one way to help treat clinical depression. Therapy is another way, and usually the combination of medications with therapy is the most optimal approach. Also, you want to make sure there's nothing that you're doing that is causing depression. For example, living a sedentary lifestyle, people may be more prone to depression because that can lead to obesity and things like that. People who exercise regularly can have a sort of antidepressant effect. Also, people who eat healthier tends to have more antidepressant effects, whereas people who eat a lot of junk food or sweets or sugars can lead to more depression symptoms. So those are some things to consider. Also, to evaluate if you have any medical conditions that are causing depression. Is there a lot of stress that one is going through that may be contributing? Maybe it's certain relationships one has in their life. Maybe it's a spiritual component. So there's a lot of factors that play a role in someone being evaluated or treated for depression. So be sure to talk to your medical or mental health provider about what you're going through and have one of those thorough evaluations before jumping to any medications or specific treatments for depression.